gradual process. It will not happen in a day to increase your bone mineral density. It will take its own time. Usually, if you do a DEXA scan now and if you do have a negative score, so at least it takes 3 to 6 months to build up your bone. It's a continuous daily kind of process you do have. So apart from your whatever calcium supplements or the drugs we sometimes give depending on the osteoporosis score and the symptoms. So what these 3 or 4 things which I already told is like to have your apart from your these supplements, you should have your weight reduction. You should have really good kind of exercises. Like I want to stress over here, like there are weight bearing exercises or the resistance training exercises. These are the two different kind of exercises which are very essential for bone health. So even like weight bearing or like daily walking. See, for knees and for your back, if you walk, have a brisk walk. It should have some speed, some 40 minutes, 50 minutes. Your heart rate should increase. That brisk walk, yoga, your stretching, or even aerobic exercises. So this should be your essential part with weight reduction. Then the diet supplement, avoiding this junk foods or the alcohol or smoking. And whatever diseases, if you are having, you should try to control them simultaneously. And if you have a severe osteoporosis, then only fewer medications will try to hasten your bone mineral density rather than your all these supplements. Supplement will take its own time, but certainly if you go on taking these things, at least your this bone health will be maintained continuously. And then at certain period of time, we certainly advise fewer nowadays injections which are also available. The teriparatides which we are using very commonly nowadays, especially in elderly females. Again, they are like insulin kind of injections where you need to inject them subcutaneously daily. Though they are very cumbersome, that is the safest and fastest way to gain back your bone mineral density if you want. Hormone changes start occurring with your menopause, like the ovary function is getting less, so estrogen is not present in the body, so that will deplete your bone mineral density, and this will cause your bone framework to get weaker, and they are more prone for injuries like the falls. You would have could have some kind of fractures. So these important thing is like the osteoporosis patient, like symptomatic. If whatever the females which are present here, if you done bone mineral density, especially of the menopause or postmenopausal, that only will determine that you are having some kind of osteoporosis. So it is a silent disease. Once you start developing symptoms, like if you are having back pain or if you had a fracture, so if that is the first manifestation, already it is a severe osteoporosis where this thing is happening. So it's important to have the awareness of this thing, because like in other diseases, we have some kind of chest pain, discomfort, and then a cardiac thing, and all these things will come into the picture. But there are certain preventive things which you need to understand, which would happen for all these menopausal and postmenopausal women because of these hormonal changes. And you need to categorize them individually, and depending on the problems, usually we consult, and then only we decide whether to go for BMD and other treatments as well. Time to have a sunlight exposure. There was a lot of debate on this, but again, it all depends where are you staying. Like you are from India?
I'm from India, but living in Dubai.
Okay, so it's what usually we classify as the equator. If you are near, it all depends on how much the intensity of sun in that particular region. Like I stay in central India where the sun is quite hot, as you all know. So it's like here smallest amount of exposure even for 7 to 8 where the sun could be much brighter sometimes. So that is sufficient. So it all depends on in the Western countries, like if you are towards the poles where the temperatures are less, there we usually recommend even the afternoon sun bath as well, because you know they go for the sun beaches, and then even these sun baths along the side sea beaches. So the temperature is more in the afternoon. So depending on your location, you need to titrate. And usually, not the very early morning sun. It has to be a good sun has to come out. You should actually able to see it. It's not the light sun. It has to be a harsh sun. At least 20 minutes, 30 minutes is recommended. Heel pain, again, it usually is not because of the osteoporosis. There are other important causes. Again, one of the important problems which happens in females. The various things, if it is happening for a longer time, maybe it's like kind of enthesitis, what we call it as. So you need to certainly check a few parameters where it is more common, like the thyroid patients. If you are having a hypothyroidism, if the patient is having a diabetes, if there are some rheumatoid arthritis or some kind of inflammatory diseases, these people are more prone for having such kind of heel pains. So if it is, we need to rule out those conditions if you haven't checked those. Then further,
I don't have those. Sorry.
if you haven't,
Yeah.
you should do the blood test before, the patient. The many females come to me with heel pain. I just do their sugars. Sometimes they turn out to be diabetic or hypothyroidism. At least 50% female, if that heel pain is not responding from 3 to 6 months, they will have some kind of underlying problem which is causing this heel pain. Osteoporosis is a asymptomatic disease, it's a silent disease. So sometimes the symptoms will not happen. So if you have your decreased bone density, the few things which could come into the patient's psychology is the weakness or the fatigue. If you are doing some activities, certainly get stressed out, you don't feel energetic. Some kind of weakness, inherently some kind of all over body ache, and then localized to like it's a generalized osteoporosis. And if the things goes to a particular region like the spine where the osteoporosis is more common, then you could have the back pain as well. And then if certainly the things are more gradually, they are the bone density is decreasing. Even we have found out the decrease in height as well, because bone makes your height. And another, if the patient is not ready, you find few older age female with stooping posture forward, the kyphosis, what we call it as. So these are the advanced stages where you could have those kind of symptoms. And then ultimately a fracture, which is happening at the locations which are told, could be one of the symptom where the low bone mineral density is there. Caffeine, I wanted to recognize, like even I eat a lot of coffee, but again, caffeine is certainly not in a higher quantity, certainly not good for your bone health. It's in the limited, even I don't know whether you are aware of this, the universal guidelines for drinking are there. Like if you certainly want to drink, they say that your 2 standard drinks per day are allowed, and you should have 2 holidays for those drinks. This is a permissible limit which has been come up. I don't know whatever study they have done in the foreign population, and similarly could be there. Like the calcium issue.
Fish oil. Fish oil. Fish oil.
Fish oil. Fish oil, I don't know about the calcium intake. What we usually see, the fish who has got the edible bones or the very soft kind of fishes, like the sardines or salmons. These are the better sources of your vitamin D3 as well as calcium. And as far as the tunas or the other fishes, they are not that high. There should be soft fish with the edible bones, sardines or salmons I could recommend.
Actually, she's asking, probably she is a vegetarian. Probably she wants to take the
Yes.
fish oil tablet.
Yes, I'm vegetarian.
Okay.
Yes, I'm vegetarian.
Yes, Ritu.
Yes, thanks.
So is there a tablet with fish oil? I think
Yes,
cod liver
yes,
oil
it's
tablets
yes.
used to be there, isn't it?
Yeah. Same kind of thing. It's available in the market everywhere nowadays.
The omega-3, I think.
Omega. So these are again the different. These are the antioxidant, basically vitamin E kind of therapy. These are this kind of cod liver oil or the fish oil or the avian vitamin E. these are all for your good skin. The other, apart from your bones, there are other connected tissues, the metabolism, where we need this kind of supplements. Physicians will certainly recommend such kind of supplements to few of their patients.
Thank you, doctor. We have all of them answered, and yes, Vasu, over to you if you have any questions.
Yes, I always have a audience question also, no? So we are talking about menopause and osteoporosis. I also wanted to ask you, is there anything else, any other thing that women go through because of we have not taken care of something regarding bone? Because you said fast walking, yoga, strength exercise, you said vitamin D. In spite of doing all these things, is it possible that you land up with arthritis or you land up with osteoporosis? Because not just this, even the food that we eat, even though we are thinking that we are eating good food, but it's now we don't know outside where the food is coming from. Especially we are living in a place, UAE, where the sun is very hot, and yet there is food available 24/7, 365 days, all kind of food. So we are not even eating seasonal, doctor, here. Because for us, everything comes from outside. Where there is very limited that is grown here. So even if I'm eating a green vegetable, as you recommended, I'm not sure whether that is helping me or not. So is there anything other than this, what you have recommended? Is there anything that we have not heard and we have not asked you and you want to share?
Yeah, absolutely. That's a very good point which you have taken out. It's like you do have a friend of your similar age, a similar stature, and that the lady or your friend could land up into the knee arthritis with similar weight, having these things. You are almost maintain the same kind of lifestyle. So there are certainly other factors apart from whatever we can, because these are the routine things which I think most of us know, most of us try to follow. Still, there are some genetic factors, genetic predispositions is already there. Then there is certainly a family history. If your family is having previously osteoporosis, the mother is having a fracture history, then certainly the chances of the sibling having such kind of fracture are very high.
Okay.
Predisposition for arthritis is again very important family history. If the mother is having early age kind of arthritis, the sibling could have the similar kind of arthritis.
Okay.
In the various diseases, if they are having previously, which could certainly land up with some this kind of even the reduce your this density. Osteoporosis, another is the pathological, where because of some problems our bone starts getting degenerated. Because of these diseases, our arthritis start developing.
Okay.
Sometimes even we see a lean, thin patient who has a good, well-balanced diet, totally doesn't have got any addictions. Still, he could have knee arthritis and could land up into knee replacement surgery. So there are few factors certainly beyond our control, which we cannot have sometimes in our hand, and still we could land into such kind of problems.
Okay. So knee replacement surgery, you're a specialist on it, right?
Yeah.
So if there is one knee replacement is done, is it necessary to do the other knee also?
Okay. It all depends on the what problem the other knee is having. Like
if it doesn't have any problem?
Absolutely, you should not do it. The only indication to go for surgery is the patient should demand it. The patient should have pain. She should have some discomfort in walking and some kind of daily trouble happening to your knee. So the only my indication to go for knee replacement, the patient should demand it. She should have such kind of pain, not tolerable. It is increasing, not responding to the medications. Her daily activity levels are getting difficult. She is becoming dependent on somebody. So if dependency is increasing and pain is there, these are the only indications where you should go for a knee replacement. Certainly try to have other methods as well. And what happens if one of the knee is replaced and even the other knee has got some initial problems? So what happens? Your other knee suddenly gets corrected, suddenly gets better. So you walk better. So all the stresses which you used to put on the normal limb suddenly goes equally. So even whatever early arthritis there on the other limb starts getting better. So even you could like prolong, or sometimes even could not go with the knee replacement of the other side in such cases. That's the advantage of having going for the one side.
Okay. All right. Actually, that question just came in. That's what I asked on my behalf of my sister. She had a knee surgery a long time back on one leg, but now after so many years, her second leg is troubling. So she has a memory of that surgery, very painful and very this. So she's refusing to do the other one, and she's also obese. You know. So that is the reason I asked you.
She doesn't have a good experience during the first surgery, maybe.
Yeah.
But nowadays, what we usually is like the with good newer advances, like whatever pain management techniques which we usually follow. Even we could have a good zero pain, like all the painkillers we give it like the PCA, patient controlled analgesia. Like the patient is having pain, automatically that drug will be released. If it doesn't have pain, the drugs will not be released.
Wow.
So such kind of things are certainly a bad experience during one knee would make them avoid for going for the another surgery. And but if she has got a good result, that surgical experience is for a week or two. But if you have good result for over so many years, I think that smaller duration should not matter much to get the final best result.
I will come with her to meet you, Dr. Manoj, for sure. That's what I told her, that I have found a good orthopedic, and we will come to meet you. She lives in Mumbai, so it should not be very far for her. So in future, we will come and meet you.
Sure, Dr. Vasu. We have a couple of questions. I'll just quickly ask. One is from Arnie. She wants to shed some light on HRT. HRT and here orthopedician. Yes, doctor, would you be able to comment? It's a hormonal replacement therapy.
We actually asked him sometime back, probably Arnie was not here. I asked him about whether that has a direct relationship with the metabolism of the bones. And he had answered, doctor, if you want to just
a brief if sometimes the ovaries which are taken prematurely in few females because of some condition of, or the hormones are getting depleted, which will lead them into some kind of cancers as well as the osteoporosis. So certainly this hormone replacement therapy is certainly indicated in those kind of patients, and they should certainly go for it. The benefits are much better than the few risks which this replacement therapies do have. I am not an expert in these HRTs, but certainly such patients coming to me with having some kind of hormone replacement when their ovaries are not there, certainly their bone stock is good, and the chances of osteoporotic fractures are less in such patients.
Thank you for patiently answering all our questions for the last 1 hour. And we got a lot of doubts clarified through you today. And this is one of the things that we are very proud of at Hold, that we are able to bring the experts to talk to the people who are having real problems that they cannot open up and speak, and we are making allowing them to discuss directly with you. Audience, we have a YouTube channel. Please subscribe so that you can see the video once it is out, and you can also share with your other friends who are keen to know about this specific session and the other sessions. Vasu, over to you.
So, when she says over to you, I will start thanking you. Then I know I have told Anjali to thank you. Then she will thank you. So we are so overwhelmed with your presence that we all will thank you one by one. So forgive us for that. I will invite Anjali, and thank you so very much, doctor. Thank you.
Okay, thanks again, Doctor, for clarifying all our doubts. You patiently answered, and it's an honor to have you here with us. Thanks once again, and thanks to Dr. Sanjay Bajaj also, who recommended you
I must thank you and Sanjay for giving me this opportunity to be on this platform. I'm also certainly privileged to be with amongst you all the whole forum. Certainly a good initiative which you have started, because these things are certainly educative things. Certainly they are not very commonly, because we read sometimes the internet which might or might not decipherate the proper information which could or could not be correct. So whatever
Yes.
we call the WhatsApp University or the Google University, we doesn't know the answer sometimes correctly.
Yes.
To have it like the good knowledge through this forum will certainly spread good information for all the viewers for your this whole sessions.
Also, more than that, doctor, some of the things that we are not able to talk outside, or we are not able to speak, especially hormonal health for women has always been a difficult topic to talk, and it is there throughout our life. At every stage there is a change, and there is every stage we have to deal with it. It's part of our life. So that is why we created this forum, so that all, whoever wanted help, and we could, experts like you who are so generously giving your time to us, and you're able to come and actually create that awareness, and make us more. I am going for a bone density test, because I want to know whether
First, we will take a group
anyway.
picture before.
Sure.